you mentioned marijuana in this case, or smoking, but is living in, for example, a very, very polluted city with poor air quality a risk factor? I mean, how closely is our environment, our lived environment, going to affect what's going on inside of our wombs?
Yes, that's a great question, Sheridan. And there are multiple studies now that show that social disadvantage, by whatever means you measure that, and that includes the density of the living environment in terms of the number of people that are physically co-occupying, the scarcity of food and good water systems,
Right.
the fear of being in a place where your environment is fearful, whether it's some inner parts of the cities where inner city violence may be common, or some parts of the world that have unstable political environments. That all of these components, combined with environmental toxins, poor air quality, high radiation exposure, frequent exposures to viral and other parasites, all contribute to higher cortisol levels in the mothers, to this priming of this negative impact on the fetus, and to higher risks of all of these other things in terms of negative ability to care for the mother. So there's the two hits: the maternal stress of being in those environments, programming through the endocrine and the immune and the inflammatory axis, all of the organ developments, and the negative capacity for the mother to get good care of herself. And I would certainly say that in some of those environments as well, the thing I'm trying to advocate for, elements of calm, elements of peaceful moments, are almost impossible for humans to find. And the cumulative stress of that prior to, during pregnancy, and during the early periods of bonding with your baby are all likely to contribute to a very challenging barrier to good development.
Right. I also see that it's also subjective. For example, a woman might be in New York City and she might be surrounded by a lot of affluence, but if she's feeling stressed at work, or if she's then that might also have an effect on the way the baby is feeling, or and I think of particularly the vulnerable women who are maybe migrants, who are under incredible duress during that time, what the effects are long term, probably generationally, for them and their offspring. So do you have any suggestions about how we, as people who are supporting women who are pregnant, can, what kind of behaviors or changes can we adopt to help support mums during this time?
So one of the things that I think is very powerful is establishing a community. And I think one of the things, whether you're in New York in a very busy job, or in an isolated rural area in the world, that sometimes happens is isolation. And isolation provokes and accelerates much of these stresses. And any way that groups of women who are going through similar experiences, so these are often the old-fashioned, birth preparation classes or prenatal classes, or being able to find communities of women who support each other, who share their experiences, who share their solutions, who bond and are honest and human in their connection between each other, I believe is very powerful at reducing stress, because you do not feel you're alone. And you can be just as alone in the middle of New York City in a very affluent environment as you can be in any other part of the world.
So what can we do then, for example, in a home environment to potentially improve outcomes for a pregnant woman?
So once again, it's obviously going to depend where in the world you are. But in any home environment, being able to minimize negative environmental exposures, as you've said, so removing things that could be toxic in the environment, being able to find and source good food, and that means obviously good protein nutrition and good fresh fruit and vegetables, and supplementing those with prenatal vitamins or other supplements. And then being able to find ways where you can down regulate your own cortisol response. And that may be human connection with friends or family, that may be music therapy, that may be your church environment and the supportive community in your religious environment, that may be just teaching yourself mindfulness and meditation either through your training within your religion or through other types of ways where you can really bring yourself into the present and calm things down for yourself. So I think bringing these elements, this COVID era that we have all been through has really accentuated this for many of us.
Right.
And we ourselves, even as medical professionals, have been under tremendous stress. And I myself even have brought in mental health professionals on a weekly basis for my physicians to help them. And some of the tools that they have been using are the same as would be relevant in this, exercise, good sleep hygiene. Sleep is critically important during pregnancy too. Being able to find a calm space where you can be connection, human connection, gratitude. For many of us during the day, it's very important to find something in life to be grateful for. And so many of these things have been shown in good studies to be able to reduce your cortisol levels, to bring your stress levels down. But they're not things we commonly talk about. We talk about, many other things, especially things that are in the news or things that are happening in our homes or the desire to have this or that, and we don't emphasize these fundamentally important human things. For myself, it's a walk every evening in nature around a lake area that brings me down to connect with nature. And so I think ways that people can understand for themselves what it is and prioritize it, not as the thing that is nice to have, but as an important prescription for daily life.